Hi guys, welcome back to my channel, Life of a Caribbean Nurse, and I am your nurse, Nurse Ray. Guys, today we'll be speaking about diabetes and the foot. Guys, the last video we did a video about diabetes' impact, signs and symptoms and all of that. Today we're going to be zooming in on the foot. Sometimes as diabetic patient, it becomes very overwhelming. You have to be following up with doctor's appointment. You have to be checking your GMR daily. You have to be do meal prepping, a lot of things to do, and it becomes overwhelming. And sometimes the foot get left behind, right? However, as I stated in the initial video that I'll put in the description box, a link in the description box so you can go and watch. We spoke about diabetes neuropathy. Basically, that's damage to the nerve ending, which leads to decreased sensation in the extremities. So you might find you're not feeling as well as you used to feel. So you get a cut on the foot, you might not even know. You put your foot in water to wash it and the water is hot, and it might not even feel hot to you because there's decreased sensation there. And also decreased blood flow to extremities. Once the blood is not flowing as it ought to flow, when you have a wound developing there, the healing process is going to be slow. Healing process becomes slow, you put yourself at an increased risk of infection, right? So yes guys, so here are some tips about how to deal with your foot as a diabetic patient. Nurses watching this video, you can tell your patients, and diabetic individual watching this video, follow on with it. If you're not even diabetic and you're watching this video, share it with somebody that you know. It will definitely help. All right, do not be selfish with information. All right, check your foot daily. Right, check your foot for cuts, redness, swelling, sores, blisters, corn, callus, or any other changes to the skin. If you're unable to see the bottom or the sole of your feet, get a mirror and check it. Right, because sometimes you might be a person that is fat and you're not able to bend adequately to check your foot properly. If you cannot do that, not even with the help of a mirror, go to your doctor and ask your doctor to examine your foot, right? So get your foot properly examined by a doctor. That means in the case where it is examined by either you or a doctor and you see where there's blister, where there's any fungus developing or anything, it can be dealt with right away to prevent any further breakdown of the area. Foot bath, washing your foot. It is very important to keep your foot clean and washed. Wash your foot in lukewarm water, not hot water, but lukewarm water. So as we spoke about initially, sometimes we have decreased sensation. Diabetic patients have decreased sensation to their extremities. So if you're not sure, it's always very important or very good to check the temperature of the water with somebody that does not have diabetes neuropathy. Even though what you can take can be different for the individual take, you just want to ensure it is lukewarm and not hot. All right. When you finish washing your foot, I'll advise you to pat dry it. So do not be harshly rubbing, the foot. Pat dry the foot. Ensure that you dry between your toes properly. So dry between your toes properly. Moisturize your foot. Keep your foot moist. Keeping your foot moist prevent your foot from cracking up. So it's important to moisturize your foot. Do not moist between the toe. Moisture between the toe can lead to infection, fungal infection, and you do not want that, because with any form of infection, fungal or whether it be a next form of infection, that's breaking down. And in a breaking down of the skin in a patient that is diabetic is dangerous. All right. Never go barefoot. So all right, whether you're inside your home or outside your yard, practice to wear shoes on your feet or slippers, because you don't want to have that foot developing a cut or a scar from anything that might scrape the foot or any abrasion, and because of decreased sensation you did not realize, and now you have a wound that you have to be thinking about caring for, or a wound that you do not even know exists, right? So wear shoes, do not go barefoot. And when you're wearing shoes, ensure you're wearing your proper size shoes. So do not know if you're a size 9, foot and be wearing a size 8 shoes, you know, because you're putting your foot yourself at greater risk. So you're going to wear proper shoes. So you make sure you wear your proper size shoes to prevent cuts or abrasion or scrape on that foot. Check the shoes before you put it on. Check to see if there's any particles, any pebbles that might have gone in the shoes without you noticing. Right? So you check your shoes for that. Nail care. Cut your nails straight across. Cut your nails straight across. If you're unable to do that, either you have your doctor do it or you have an individual that is trained to do it to cut your nails straight across. Do not cut your nails straight down in the nail bed. Cut your nails straight across and then you use a nail file to gently file down any sharp areas that might be there existing that you do not realize or you did not realize that was there. So cut your nails straight across and file down any sharp edges. If you're unable to do it, go to a foot specialist and have them do it for you. Okay? Don't remove corn or calluses by yourself, especially with the use of over-the-counter products to remove them that could burn your skin. So you realize you have developed a corn or a callus, whether it be in your hand, on your feet, anywhere at all, you're going to go to your doctor and have them prescribe something that as a diabetic patient will work properly with you, will not cause you to develop any burns on your skin because it was too harsh, right? So you seek the proper medical help. Don't go to Sister Patsy and make she tell us the last time that she had a corn, she did buy something over the counter that worked well for her. Remember that you are a diabetes patient, a diabetic patient, and she is not. So what might work for them might not work for you. So it's not that the advice that they might be giving you is wrong, you know, but what works for them might not work for you. Please bear that in mind. All right. Choose foot-friendly exercise. So when you're home, you come home from work, practice to elevate your limb, to increase blood flow and tingle your limbs. Tingle your toes, I must say, tingle your toes. So elevate your limb to increase blood flow throughout the body and tingle your toes to exercise your foot then. All right. Also, you know, you can practice motorcycling. You can practice swimming for those that can swim. Just practice foot exercise that you know are going to aid with the circulation of the blood throughout the body. Also, there are certain times when you know that even when you're doing all of this, you need to see a doctor. You realize that you have developed pain in your leg, right? Or cramp in your buttocks, thighs, or calf during physical exercise. Visit the doctor. You realize that you're having tingling, burning, or pain in your feet. Remember, we spoke about neuropathy. These are signs of neuropathy. Visit your doctor, right? You realize that you lose your ability to sense when something is too hot, right? Visit your doctor. These are all signs of nerve damage. You realize that your limbs are becoming very dark. Visit your doctor. This is a sign that you're having decreased blood flow to the extremities. Do not see it and then you tell maybe a friend and they advise you. Say, all right, one, look up bush A and bush 2. This will work well. It worked with my daddy in 1962. It might not work with you. Visit your doctor. There are certain signs and symptoms that you realize going on. Visit your doctor. If you realize that your glucose level, your blood sugar level is, no matter how you feel like you're taking your prescription, the medications on time, and it's still high, visit your doctor because maybe you need to, the medication, the insulin might need to be adjusted. So visit your doctor. Because remember, if you see all of these things happening and you do not seek to medically intervene, right, on what is going on, it will become problematic to you in the future. Because with a constantly high blood sugar level, it decreases your ability to for the blood to circulate properly. It decreases the healing ability if you develop any cut, right? Scrapes, abrasions. It decreases all that ability, right? So practice that. Tips also, otherwise from foot care, when doing your foot, eating healthy will aid in foot care also. So though it's your foot, your eating habits determine whether or not your foot care will be good or bad. You know, practice drinking a lot of water. You know, if you're a smoker, cut out the smoking, stop smoking, because that makes your blood viscous, meaning thicken the blood, right? And if your blood get too thick, it not go circulate as easy. Guys, sometimes we can aid with our cure, right? We can aid to prevent certain illnesses from taking over our body, certain diseases from taking over our body. Yes, you're a diabetic patient, but guess what? There's something that can be done. There's a way that you can prevent yourself from developing an ulcer on your foot. There's a way that you can prevent yourself from developing a wound. There's a way that you can prevent yourself from reaching the state where you might be needing an amputation. You might be thinking about getting prosthetics. Prevention is better than cure. Guys, share this video with somebody that you know will watch it. Somebody know it will teach something new. Do have yourself a blessed day, a blessed week, a blessed month, a blessed year. God bless you all.